Well, more and more South Africans are at risk of vision loss. This is due to diabetic eye complications and age-related visual conditions. Well, now because of this, Retina South Africa and the Ophthalmological Society of South Africa have joined forces to create awareness during this World Retina Week. Society President Dr. Gerhard Kok talks to us about this morning. Doc, a very good morning and thanks so much for your time. So let's talk specifically here in South Africa, and we know diabetes is a major problem here as well. How much of that contributes to loss of vision among our population?
Good morning, Rebecca. Yes, diabetes is becoming a bigger and bigger problem, especially in a country like South Africa, a developing country, changing of diet, changing of lifestyle, decreased exercise, not healthy eating, etc. And because of that, patients can also develop retinal complications. So a lot of diabetes know that they can get other complications like kidney complications, etc. But a lot of them are not aware that they can actually get eye complications, especially retina complications. As you know, the retina is the layer of cells at the back of the eye that is light sensitive, that actually helps your brain perceive the image. And because of the diabetes, there's damage to the small blood vessels of the retina, and that can actually lead to vision loss.
So
worldwide is the most common cause of vision loss.
Doc, is this necessarily age-related, or does it actually depend on just how seriously diabetic somebody is? So you could be in your 30s and 40s, but just have a very serious case, and could that, in that case, affect your vision? Is it necessarily as you get older with diabetes?
The diabetes complications is not just age-related. It's more related to the level of the diabetes and as long as the time period for which you've had the diabetes. So you can be young, you can be in your teens or 20s with a type 1 diabetic and already have retinal complications. And the big danger here is that oftentimes, initially when the retinopathy starts, patients don't perceive any symptoms. And when they start perceiving symptoms and start losing visual loss, there's already a lot of damage to the retina that sometimes cannot really be repaired. So the key to the success is actually screening and early diagnosis that we can manage and prevent the visual loss.
So there's no way that this can be reversed if one finds out that you're diabetic, or you actually get with a program and start taking the treatment and looking after yourself, and the diabetes sort of is manageable. Can the vision loss not be reversed?
So if you've got bad vision loss, that can in many cases be permanent vision loss. Some of the cases where there's smaller hemorrhages, etc., is actually amenable to treatment. But the key is still to diagnose the patients early, even before they start losing vision, because then sometimes certain treatments that we can institute early can actually prevent that whole process of vision loss. The most important thing for diabetics for themselves is not just to go for the screening, but also to make sure that the diabetes is well managed. There's a specific blood test that we look at, which is called the HbA1c test. And if that test is at a specific level, we know that your chances of actually developing end-organ damage, including visual loss, is actually at a minimum. So prevention of visual loss is the key, because some of the visual loss can be permanent.
So does this necessarily, what's the worst case scenario? Would it be complete blindness?
Yes. Obviously, in some patients that come late, in my own practice, I sometimes get patients that present very late, and they've got such bad damage that they're permanently blind. I can just think of one or two patients earlier this year that I've had that already in one eye they're already blind, and other eye already severe visual loss. And then it's just a fight. We just have to fight a battle just to maintain some kind of vision that they can actually function with. So yes, worst case scenario could be complete blindness, and it can be irreversible blindness.
All right, so what do we want people to start doing, Doc? I mean, even if those who don't know that they might be diabetic, are there a variety of tests or checkups, and are they affordable for majority of the population as well?
Yes, I think especially if we look at our primary care clinics, if patients go timeously for a checkup and make sure keep their sugar levels are fine, and make sure they don't have diabetes, I think that would be the first. Sometimes, especially with type 2 diabetes, you might have the diabetes and not know it. So that on one side is important. Second thing is, if you're already diagnosed with diabetes and you did not know that you should go for eye screening, and you will be surprised how many patients walk in my door they're already losing their vision, and nobody ever along the way told them that they have to go for eye screening. So I think that's the second important point, is if you're diagnosed with diabetes, not only try and live a healthy lifestyle and try and manage your diabetes as prescribed by your doctors, but also remember to go for the different screenings, including your eye speed test, even if you don't experience visual symptoms, because sometimes we might find things in your eye that's not giving you symptoms yet, but if we leave that maybe for 6 months or a year, you might start losing vision. So those are the two crucial points.
All right, so pay attention to your body, especially your eyes, when it comes to diabetes. Thanks very much, Dr. Gerhard Kok.